Welcome to Stay Alive and Fit with Liz Goodman, a new innovative radio show that taps into what's happening now in the medical industry, featuring fitness experts, foodies, and medical professionals from Tenet Health. With breaking medical news from David DePino. Get it right here and be an active participant in your health. Mixed messages about what is best for your health can make you feel like you're on a runaway train. So hop on and have some fun while Liz navigates this medical mystery ride. Call 888-565-1470 and ask Liz, your source for the latest medical technology and long life advice. All aboard. Here's Liz Goodman.
But for the tribute. Hey, everybody. Welcome to Stay Alive and Fit. We're a new innovative radio show, and we tap into what's happening now in the medical industry. So tonight, we're doing things a little bit differently. As you can see, there's people, we've got cell phones on that have to be closed off here. We've got doctors in the room, so cell phones are always beeping. So we're doing things a little differently now. We won't be doing things with Tenet. We're starting a new quarter, June, July, August. We're starting with new doctors, new innovative information, about new technology. And this month is Men's Health Month. I was just told by these three fabulous men that are sitting with me. You can see one now, but I've got two more sitting across the table from me. And so what I have here with us tonight are, there you go. Say hi, everybody. Hi, say hi, guys. I've got three different men here. One is the practice of Paul Presti, MD and Associates. They've been in Broward County for almost 30 years. Their telephone number is 954-491-6200. They're located at 3075 East Commercial Boulevard in Fort Lauderdale. And then I also have, sitting beside me, Stephen Schmidt of Tri-Coast Pharmacy. That's TriCoastRx.com to find them online. He's the director of pharmacy for the company, and the telephone number there is 561-252-2592. That's 252-2592. And since it's Men's Health Month, we're going to be talking about things that affect men. I can't even speak. I've got three great guys here, and it's just making my hormones crazy. So we're talking about hormones and testosterone and all sorts of things that affect men and women. As I was joking to these guys before, I did not know that women not only have estrogen, but we actually have testosterone. And I could tell you for sure, most of the men in my life tell me I have too much testosterone. Anybody who knows me knows that I like to take the bull by the horn, as we all can say, and just make sure that, I'm in charge of what's going on in my life and in my health. Somebody's dinging. Is that me? Who's dinging, Doc? Somebody's dinging. I don't think it's me, but somebody is. But so this show is going to be about hormone therapy for men, estrogen therapy for women. And before I get into all the things that we're going to talk about, which I hope you're going to call in about, I want to explain a little bit about the practice of the gentleman sitting in the room with me. First of all, the practice of Paul Presti. They've got some really great things going on with their practice. Not only have they been in practice for more than 30 years, but I'm going to name some of the people that are in their practice. We have physicians that include Dr. Karen Williams. She's an internal medicine doctor and primary care physician. We have Jacqueline Woods. She is an RN, a nurse practitioner. She's been with the company for 16 years. On the endocrinologist side, we have Dr. Edward Smolder, who's been in practice for over 30 years. And Beth Greenberg, who's also a nurse practitioner. She's been with him for 4 years. We have sitting besides me, or in front of me, Dr. Frank Snipes. He's been practicing for more than 20 years.
Hello.
Right?
Hello, yeah.
There you go. And we are welcoming to the practice, he's been with them since February, Dr. Julian McQuirter. It's spelled correct. Quirter, but it's
Correct.
pronounced quarter, like the Big Mac Daddy quarter pounder. That's how he told me to remember it.
There you go. Hey, baby, I just want to say hello to my wife and kid.
Aww. Great way to start the show. So, and let me just introduce the gentleman sitting next to me, and then I'll talk a little bit about your practice and a little bit about what he's doing here. I've got Stephen Schmidt. He is with a pharmacy called Tri-Coast Pharmacy. And one of the great things about Tri-Coast Pharmacy is it's not like a big, farm pharmacy. I don't want to mention names here,
right.
But they have specialized
Compounding pharmacy.
Right, compounding pharmacy.
Patient-specific medications.
Right. So what that means, from what I've been told, is that, so let's say I have a thyroid condition or a hormone condition, and the general way of prescribing, a doctor would prescribe it 7 milligrams or 30 milligrams, and the pharmacy only makes it in 30 milligrams. But my special needs are really for 22.5 milligrams. Well, the big farms can't do that. But Stephen here, his pharmacy can specialize the dose and compound it. They use a lot of organic ingredients, and they're very, FDA approved ingredients, and they work directly with your doctor to make medication that is specific to your needs, not just the general public's needs. So we'll get into that in a few minutes. I just want to tell you a little bit about what's so wonderful about Dr. Presti's facility. And what I was told that makes them really, really unique is that they're an HMO practice for all ages that operate with VIP type of experience. Well, if you've been listening to my show, then you know this whole show is about VIP information for the masses. So I love that this company is a medical facility that is VIP for the HMO, because HMO people don't get that kind of VIP care. And what I mean by HMO VIP for them is that they not only do they focus on senior care and VIP for all ages, but their hours of operation 9 to 5, like all doctors' offices, but you can reach their office up until 7 p.m. They're open 5 days a week. They never take a lunch break, and I mean ever. They're available on Saturdays and Sundays till 2 p.m.
For on call, yeah. We're not in the office as such.
No, but what I was told is that your administratives are there. If you want to come in and get their blood work done, if they want to get their lab work done, if they want to get their blood pressure taken, if they want to get their stats checked, you can do that at this facility on Saturdays and Sundays.
Primarily the administrator, Donna Golden, who works tirelessly, does that. And she's there on Saturday and Sunday. So
she's phenomenal.
And she's there all the time. Seriously, 7 days a week.
Yeah, and that's what she was saying. So she's available all the time. On call all the time. I mean, she almost had me give out her cell phone number, but I'm not going to do that. She'll really hate me if I do that. And so, I just want to talk about that for a few minutes before we get into, the gentleman next to me. But, what makes that so special to me, what makes them different, is that from what she said to me is not only, you close at 5, but, the doctors will take calls till 7 p.m. also, and you'll give out personal cell phone numbers, and you give them that extra bit of care that most other hospitals and doctors don't do, right?
We try to. My whole objective is to make a patient feel like they're coming in to see family. And one of the things I try to make sure they receive the very best that medicine has to offer, the latest, what's ever on the cutting edge, but also delivered in a way that I would want to present it to my own family members. So when I reach across the table, so to speak, and they reach out to them, I'm not trying to treat them as a patient, but more or less, this is a family meeting. I'm meeting a family member. I'm meeting for the first time. What can I do for you is how I take it.
And they do get attached. The patients get attached to the physicians. Certainly I can speak for me, get very attached to these patients. And it's fun to watch them in a longitudinal way, that they're getting better and so on and so forth. So you really do get wrapped up emotionally in these people. One of the things that I probably do too much is talk too much. I'm usually a little bit late and delayed, but basically, I get reprimanded for that occasionally. But basically, that's the but it's a good thing. And talking to these people and making them feel comfortable, and then that's when you really find out a lot of their problems that are coming out when you get a report and they feel comfortable with you, and then they'll talk about, oh my gosh, I'm depressed. I came in for such and such, but I'm not sleeping and blah, blah, blah. So
or even what some of their obstacles are, that we can actually help them and allocate resources, but you don't find those out until they feel comfortable enough to share those with you, whether it's transportation and, there's a bunch of things I'm trying not to...
You really do. And you can get involved, as Julie and Dr. Recorder were saying, you can get involved with their social problems as well. They may need transportation. They may need your medicines called in so that if they ride the bus, they don't have to wait an extra amount at the pharmacy. So, and coupling this to Stephen Schmidt, we do deal with the pharmacy a lot, and we do call them and talk to them. And I've talked to him personally on the phone and worked out those individual dosages and what they need.
And it's nice to know that you still have the little guy out there making a difference, where you can call the mom and pop's pharmacies up and be like, look, we need this for this specific patient. And usually we need this particular compounding is hard to find, because we won't mention big names, but they don't do that. And it's nice to have that, the hands-on, that personal touch.
So before we get into the personal touch, I want to just circle back a little bit to what I was so intrigued about and why I wanted to bring you guys on the show when it comes to this practice. First of all, I was told that, you're a new part of the practice, and that you know that you guys are going to be like a powerhouse team. And what's really nice about you, Dr. McWhorter, is that you not only have you been in practice since February, but that you're a hospitalist, which means you admit doctors and you maintain your privileges over at a 5-star hospital, which is Holy Cross, which is located in Fort Lauderdale.
Yes, I do.
And that's a wonderful thing for patients because you can get them right in. You can call ahead if they have to go to the ER.
Yes.
Again, the HMO patient doesn't normally have that kind of service. And I know just from my own experience with Dr. Snipes that, and from just speaking to Donna, where she's like, you know what, the problem with these doctors is that the patient's supposed to go in and out because that's the way that you have to do things, especially with HMOs these days. But your practice, you say, you know what, I give them that extra time. I know the administrators don't want you to take that hour with them. You do want to take the hour because you guys are filled with heart. So the point of this show, and what I'm hoping we're going to develop over the next couple of months working with you guys, is to give your patients the chance to have that VIP treatment, to take diaries, write down all their questions medically, write down what they're going through, write down what they're experiencing. If you're listening to me, these guys are going to be on our show hopefully on a regular basis, and you write down what it is that's ailing you. And instead of spending an hour in the office with them talking to them about everything that may not be the reason you're there, because that's a time management issue for them, and they really need to do what they need to do during that time that you're in their office, you'll be able to call in here weekly or monthly and ask them those questions right here by calling 888-565-1470, 888-565-1470. Or you can email me at liz@stayaliveandfit.com. That's liz@stayaliveandfit.com. And you can like us on Facebook. But this is what we're doing. The purpose of this show is that you can get in touch with these doctors and have a VIP experience and ask them any questions that you've been tracking about your medical history during the last however many months and have an opportunity to speak to them directly off hours. So that's a really wonderful opportunity.
One thing I wanted to correct also, we see essentially all kinds of insurance, not just HMOs, so we see all kinds.
Oh, right.
And I will say another shout out to Donna Golden. Donna Golden is the office manager, and she knows these patients, I'm telling you. She knows their histories, she knows who they are married to, where they live, so she knows a lot about them, which is phenomenal. Because
It really
she,
is.
in turn, helps us, the physicians and the nurses. So it's not just a business. It really is, as Dr. McCord was saying, it really is a family.
And she was saying, like you said, you're an expert on insurance matters. So it's not just about HMO. It's about helping people who haven't figured out the marketplace and where they want to be, helping them get the right insurance, helping them figure out what their needs are. So when they come to you, they have their answers already maybe in their back pocket before they walk in the door, because you've got great administrators like Donna who's answering the phone and getting prepared for the visit. So all of that's really great. If you guys want to, either one of you, give out your phone numbers one more time so that our listeners know who to speak with.
The office is 954-491-6200.
Correct.
Okay, so now I just want to talk about Men's Health Month for a quick second. June is Men's Health Month. The purpose of Men's Health Month is to heighten the awareness of preventable health problems and encourage early detection and treatment of diseases among men and boys. The month gives healthcare providers, public policy makers, and the media an opportunity to encourage men and boys to seek regular medical advice and early treatment for disease and injury. So one of the great things that by coincidence, or coinciding, as people say, I have 3 fabulous men, knowledgeable men, sitting with me as a way to help any man who's out there, put a call to us and get us some answers to some of your questions. But I want to focus the show a little bit on a specialty of Stephen sitting next to me, which is hormone replacement therapy. Now, we always think about that for females, estrogen and all the things that go on with women. But, there's a lot of hormone replacement needs for men. Isn't that correct, Stephen?
That's absolutely correct. And I think one of the things that a lot of men shy away from talking about is they start feeling tired. They start feeling like they just don't have the same energy level. They probably don't have the same libido, even though they don't want to actually mention that, which was one of the things that the docs and I were talking about prior to coming in. And that's one of the main important factors of having blood work done to make sure to see where levels are standing. After the age of 30, I believe our testosterone starts decreasing 1% annually at that point, and that's if we started out with 100%. So, I mean, knowing where where your levels are standing is very, very important, because not only are we going to feel better, have more energy, it's quality of life when it comes to certain things. Couple different types of, we've got the synthetics. We also have the bioidentical. So it really depends on what the patients and what the doctor is going to recommend.
So I'm going to ask you a couple quick questions about this, and I have to swipe the mic back and forth, so I apologize for that, because there's 3 mics in here and there's four people in the room. But, I don't know if this is just a female hormone thing or it's a male hormone thing too. I was just reading all these things about the HRT. Is that just female hormones? Or is that synthetics? Because I was reading that caused a lot of cancer back in the day, but that was a female
Well, really,
thing,
it's both.
correct?
HRT is...
HRT is there
Hormone
are
replacement
synthetics.
therapy, yeah.
It's hormone replacement therapy, but we specialize in the bioidentical, which is going to be a plant based, and with the it's going to be the most similar to what is produced
naturally.
Naturally, and so. With that being said, that's one of the safer ways of going about it. Now, there are certain indicators that we're going to look at. I mean, if somebody's predisposed to breast cancer, or somebody's predisposed to ovarian cancer,
It's after they've done all their screens.
Exactly. That's something that we're probably going to shy away from. But at the same time, just the overall well-being and feeling, for the female, can save a lot of marriages.
Yeah, that's right.
Oh, maybe I should have learned about that a few
He's
years
a minister.
ago. Okay, so I have a caller on the line. I'm not sure who she's calling for or he's calling for. Caller, you there?
Yes,
Oh, hi. What's your name?
Lauren.
Hi, Lauren. Have you been listening to the show?
I just caught a few minutes of it, and I am very impressed with the VIP service that the doctors are giving. I have had a VIP doctor, and I feel that I have lymphoma, and my husband also has a problem. He had a quadruple bypass, and we're in Florida, and I think that there's much need for doctors to pay much more attention to their patients, because
True.
I think it's overwhelming for the doctors. They just have too many patients, and everybody runs to New York because of that. And I think that it's a wonderful service to have personalized service, and the patient really feels very cared for. And where are you guys located again?
In Fort Lauderdale, and the address is 3075 East Commercial Boulevard, Suite 1A, like Apple, Fort Lauderdale,
Okay.
and it's 33308.
So do you have a question for the doctors, or you just wanted to tell them how much you appreciate them?
Well, I actually do, because my dad is 96 years old, and he fell, and he's in a home, and he went to the doctor, and he's on Coumadin, but they told him that he just told me he fell, and they took a test, and it came out that he has MRSA. So he's in a very high-end place, and he went down to the doctor, a nurse there, and they bandaged him, and they said, he's on a heavy-duty antibiotic, but I understand from the doctor, his doctor said it's highly contagious, and the doctor in his independent living said it's not, if he's on an antibiotic and it's wrapped.
So is your question, is it contagious or not contagious?
Yes.
I'll give my piece first. It could be a colonization, which means that the organism can simply be on the skin and not necessarily an infection, versus a true infection. The antibiotics are appropriate, because the one thing you don't want is to have it become a colonization with a laceration into an infection, and particularly in a nursing home and so on. So that being said, I think they're doing all the right appropriate things, and they just need to keep an eye on it. They may want to culture it in a few weeks or 10 days and keep an eye on the MRSA, as you say. MRSA is actually pretty common, and it is treatable, but they just have to respect it as they are. It sounds like they are doing a good job with it.
Well, do I have to stay away from him if he's on an antibiotic?
No, not at all. Not at all. I wouldn't.
No.
As long as the wound's wrapped and they're
Even
taking
if
care
she
of
has
it with
cancer, she said she had cancer.
No, the only thing I'd worry about with cancer patients is if they're on chemotherapy and their immune system's diminished, or young children or so, or babies and that sort of thing shouldn't be around people that, again, because they have small diminished immune systems. But unless you're on chemotherapy or actively diminished in your immune system, no, just common sense.
Right, and continue just good hygiene, like washing your hands, the
wash your
things that you
hands
typically do. And like you said,
Wonderful.
as long as the wound is typically covered, you're usually safe with that. Now already given systemic antibiotics as well to cut down on transfer.
And can you take, if he's on a heavy-duty antibiotic for MRSA, can he take a probiotic, or would that interfere with it, just because his stomach is going to be wrecked?
No, I don't think that's ever inappropriate at all. If they want, some people do, some people don't. I don't think it's inappropriate at all.
Can I interrupt? Because that could be a good question for the pharmacist about probiotics. So I know we have another caller on the line, so I'm going to say thank you, Lauren, for your call. And I'm going to before you go, Lauren, you can listen to Stephen. He's the specialized, personalized pharmacist who can answer your question about the probiotic.
Yeah, absolutely.
Thank you so
I
much.
don't see anything wrong with having a probiotic in there with putting some of the good bacteria back into the system. I think there's nothing absolutely wrong with that.
Great. Thank you so much.
Good luck to him.
Yes.
And if anybody would like to get in touch with the good doctors that are sitting here, their telephone numbers are 954-491-6200. We've got Dr. Snipes and Dr. McQuarrie. McQuarter.
Yes.
I've got to remember, I don't eat Big Macs, sorry.
It's okay.
Nor should anybody.
Yeah, there you go.
That's right.
So, and if they want to get in touch or order any pharmaceuticals that are specially tailor-made, they can do it through Trico's Pharmacy and speak with Stephen. I'm sure he'll get on the line with you, and his telephone number is 561-252-2592, and they can be reached at www.tricostarx.com. Now, I know we have another caller on the line. Are they there?
Yes, hi.
Hi. Who are you? Welcome.
Joanne.
Oh, hi, Joanne. Welcome to the show.
Hello.
Hi. Liz, I want to tell you, I've been listening to your show for a few weeks, and I really enjoy it, and I've learned a lot.
Oh, thank you so much, Joanne. Do you have a question for us today? Thank you so much. We really appreciate you listening.
I'm going to date myself a little bit, doctors, and tell you that I'm familiar with bioidentical hormones because I read about them for years from a very popular star named Suzanne Summers. And what's interesting to me is the discussion that you were having about how they could relate to men. And my question for you is, what's a good way to broach this subject with a man who might benefit from bioidentical hormones?
Good question,
Excellent
Joanne.
question. Usually I find that I don't use a direct approach with that. I usually kind of let the conversation flow naturally. Then I ask them, roundabout ways, how's your activity level? What do you enjoy doing? And then I even ask, how's your love life? How's the romance going? And usually I use that as my segue in and kind of start the conversation off that way.
So how does a woman get the man to have that conversation with you?
Well, you're right. Men are horrible patients. They are. That's why we,
Yes, we are.
yes, I'm telling you, they eat too many Big Macs.
And that's why we're having June as Men's Health Awareness.
Month. Because you're right. That's a good question. One thing you could do, to be honest with you, if they haven't had blood work in general, just in general health, it's a good way to get men in. They check their blood pressure and that sort of thing. And again, that gets back to why we try, Dr. McQuarter and myself and the rest of the staff there, to try to give some TLC to these people and try to, then specialize it. And then that's an opportunity to open up and talk to them about libido, sex drive, fatigue, and such. Because here's another thing. A lot of men think they're just getting old, and they're not. They're feeling achy. They feel tired. They don't feel like they used to, and they just think they're just aging, and that is not necessarily always the case.
Right.
So, Dr. Snipes, like what I hear Joanne saying is, so for her, she has a man in her life, and maybe she's recognizing some problems, and she doesn't know how she personally can approach that conversation with her husband, and then have him approach it with her doctor, with his doctor. Is that kind of what you're trying to get at, Joanne?
Yes, and I think the idea of just getting a baseline lab and sort of encouraging good physical health is a really good idea. Am I able to ask like a follow-up question?
Sure.
So,
Yes.
so your compounding lab is here locally?
It's in Juno Beach, Florida.
Okay. So this might be a little bit off the beaten path kind of question, but I happen to be a dog mom, and I have a lot of pharmaceuticals compounded for my dogs at a pharmacy in Arizona. Do you do humans and canines, or just human compounding?
Yes, ma'am, we do. We do canines also. Yes.
You do?
Yes.
That's
so
really great to know.
absolutely.
So if your dog has low testosterone, I guess you can let them know. Yeah, that's right.
Unfortunately, it's Cushing's disease, so it's trilostane compounds. But it's really great to know that you do both.
Absolutely.
Let me say one final thing, if I will. I don't think it's at all inappropriate for you and your husband or whatnot to come in together.
Right.
And,
That's what I was going to ask.
And basically say, I'm not trying to embarrass you, but basically we've been, and frankly, to be honest with you, doctors hear that all the time.
Right.
So it's not anything.
It's usually not from the person who needs the help. It's from the other, significant other.
Absolutely. So I would, if he's okay with that, bring him in, bring yourself in with the visit.
And sometimes it's better for a direct approach too, because men, like we were talking about previously, we have a lot of ego. So I mean, no matter how old we get, I mean, that's one of the things that if we're speaking, specific to the libido, that's one thing that guys have a hard time talking about. So once we feel comfortable with whatever physician that we're speaking with, that's when we're going to open up and be more honest about kind of what's going on. And if we know that that's something that's going to please the other, significant other in our life, then that's definitely something that we want to do.
I think this is really helpful, and I appreciate it. Just out of curiosity, do bioidentical hormones interfere at all with PSA levels?
We'll check the PSA markers. That's one of the reasons why we have the blood work done. That's why we do the monitoring, to make sure that everything is in a safe range. So those are markers that we're going to be looking at.
And again, that's in men only.
Yeah, that's in men only.
Relating to the prostate, or your dog.
Just for our listeners, Joanne, I'm going to ask.
I want to thank you for taking my call, and Liz, again, I really enjoy the show.
Thank you, Joanne. Thank you so much for calling. Hey, Joanne, just before you go, I want Stephen to tell you how you can get your dog's Cushing medication from him cost effectively, locally, so that maybe your vet who's been prescribing it a very specific way might have other options or alternatives going straight through Stephen. So hold on a minute, okay?
Yeah, Joanne, all you need to do, give me a call, 561-252-2592. And then basically what I'll have you do is just have your vet fax us over a script, and I'll go ahead and I'll give you a call after that and give you a breakdown as far as pricing is concerned, and kind of move forward from there.
And how would Joanne get the medication from you if she didn't want to drive all the way out to Juno Beach?
Oh, yeah, they mail it, I'm sure.
Oh, yeah, we FedEx everything.
And so it's an overnight?
Yes, ma'am.
Okay.
It's coming from Arizona now, so it's got to be closer from Jupiter.
Right.
Yes,
Is it Jupiter or Juno?
Juno.
Juno.
Oh, Juno Beach, excuse me. Yes, thank you.
That's okay. And Joanne, you mentioned the PSA number. I'm not familiar with that. Can everybody explain that to our listeners who are like me and just don't know what that is?
It's a prostate-specific antigen, and it's used as a marker that we use in men, especially at the age of 50, or it could be early if you have a family history thereof. And usually we want to see it less than 4 or whatnot, and we watch it to see if it exponentially rises or there's a bit increase. And I like to couple it myself with the prostate exam. Did you want to ask?
No, I agree with that. And the three basic reasons that a PSA, as we say, would be elevated would be, number one, if the prostate is enlarged, and that happens in men very commonly as time goes on. If it's infected, if they have a urinary tract infection or a prostate infection, or, God forbid, if they have a cancer of the prostate. So those are the big three that tend to increase or bump it up. And I guess you could also throw in the testosterone levels. If you're on excessive levels of testosterone and hormones, that can elevate the PSA.
Okay, Joanne, if you're still there, thank you so much for the call. If anybody else wants to give us a call, it's 888-565-1470. We're going to kick it to our mid-hour break and be back after the messages with some really interesting information about what you need to do to make sure that you can get your libido going, whether you're young or old, and you're male or female. We're going to start talking some hormone therapy.
Stay Alive and Fit is your weekly dose of information about health, wealth, fitness, or food, so you can live longer, age gracefully, and stay alive and fit. Liz Goodman, she's your go-to gal to solve your medical mysteries. Mondays, 7 p.m. on WNN 1470.
Hi, I'm Liz, and ask me and I will find the answers you seek to all your fitness and medical questions. I'm not a doctor or a nurse. The sight of blood makes me squeal. I'm just an ordinary gal trying to navigate through the maze of all the ways I can stay fit, focused, and feel fabulous. Whether you're 20 or 80, male or female, mixed messages about what's best for your health can make you feel like you're on a runaway train. So get on board and take a medical mystery ride with me, and we will stop at every station to find the answers you seek. Call in to 888-565-1470 and participate in the conversation. Listen on Talk Radio WNN 1470 and watch us live on amp2.tv. That's AMP, the number 2.tv. And don't forget to email me your questions to liz@stayaliveandfit.com. Mondays, 7 to 8 p.m.
Live local? Have a fitness or health question? Ask Liz, and you just might be called to guest star on her next show. Experience what it's like to get VIP medical treatment live, in person, on the air. Email your health or fitness questions or suggestions to liz@stayaliveandfit.com. Ask Liz on Facebook, follow her on Twitter, or post a photo to Instagram. And watch Stay Alive and Fit Mondays at 7 on amp2.tv or listen right here on WNN 1470.
All right, we're laughing, but we're not jamming. Yeah. Are we jamming in here? All right, so I'm jamming in here with 3 hot doctors, 2 hot doctors and 1 hot pharmacist. And I mean hot because they're hot with knowledge about all this information about what makes you hot or what makes you not hot is what really what this is about right now. Because as you're getting older, all the things that make you, I guess, feel sexual or feel sexy, your hormone levels, your testosterone levels, your estrogen levels, male and female. But specifically, we're talking about men this month because June is Men's Health Month. And, we want to talk a little bit about what, we had a caller right before the break, Joanne, thank you very much, and Lauren, thank you very much. And they were talking about, specifically, Joanne, how do you approach that subject with your spouse if you think that they don't know that maybe their libido's down or maybe they're having some hormone issues. And one of the great things about doing this show is I get to speak to VIP people who can answer these questions. And sitting next to me, I've got a VIP, fabulous Stephen Schmidt, pharmacist. He's from Tri-Coast RX. He's not the big farm. He's a small pharmaceutical compounding place. And I don't know a lot about what that means, but let me just tell you, he's located at 14141 U.S. Highway in Juno Beach. But it doesn't really matter where he's located because he can overnight your RX or your prescription
yes.
anywhere in the country or maybe even internationally. I don't know. He can answer those questions. But I want to just kick it over to him so he can explain to our listeners what it means to be a compounding pharmacy, which is what he is, and how that differs from a big pharmaceutical company. Welcome, Stephen.
Thank you. Thank you very much. One of the things is it's patient-specific medication. So let's say, for instance, that the doctor prescribes something that may be only available in 2 different strengths from big pharma. We can make that. So let's say that you're looking for, progesterone, but you need it in 100 milligrams as opposed to, or 75 milligrams, or 60 milligrams. We can, or 67.5, we can go ahead and we can compound it to whatever is going to be specific to those patient needs. And that's not limited to just hormones. Although hormone-specific things is one of our specialties, as far as, anywhere from thyroid medication, so T3, T4, combination in thereof. So that's...
So does that mean that, you take insurance, you don't take insurance. Does that mean, like, if a doctor is, let's say they're trying a certain level of medication, hormone therapy, estrogen level therapy, whatever it is, and it's not working for me, and then they don't want to jump let's say, to the next dosage, or I don't want to have to cut the pills in half or cut the pills in quarters or do all that stuff. I could have my doctor work with you directly to make a very specialized dosage just for me to try it.
Absolutely, yes. We can tailor the medication to whatever it is that the doctor recommends. As far as you touched on insurance,
right?
We don't take insurance.
Okay.
A lot of times it's going to be considered aesthetics, just like in plastics. So we don't do that. Now I do have a universal claim form that I can have filled out for you, and you can go ahead and send that into your insurance company.
Okay.
And if they reimburse you, then that's great. But
well, will they reimburse if, let's say, the dosage, let's say we were treating for Cushing's disease, which adult humans get that as well. It was mentioned by the caller that she has a canine with Cushing's. And let's say you're treating for Addison's or Cushing's, and you need a dosage that's different than what the regular, like my pets have thyroid issues, and you want to give a very specialized dosage. And the insurance company pays for, excuse me, let's say 7 milligrams instead of 8 milligrams. Would the insurance company, cover just the regular dosage, and then if they're, or give a portion of that back to the customer, or they just really have to understand that if it's being specialized, it's a VIP thing, and they just have to suck it up and find a way to pay for it?
More than likely, I'm not 100% sure if the insurance is going to cover it. But like I said, we can go ahead, we can throw it against the wall, see if it works. It's hard to say what insurance is going to cover anymore these days.
And it's just nice to have a pharmacist that works with you, because sometimes you can get these medication at these different dosages, but it takes a prior authorization and that you have to go through, or you might have to go through a couple of extra hoops. But it makes a big difference when the pharmacy is willing to work with you so that you can get the best care for your patient.
Well, one of the things I know that in our conversation, Stephen, that you and I had prior to getting on the show, you pointed out to me that most medications, especially the hormone medications, they cost less or equal to the price of a cup of Starbucks coffee. Is that correct?
Well, one of the things that first of all, you can't put a price on feeling good. But that's the main question that everybody asks me is, how much is this going to cost? And one of the things that I like to say is, if you can afford a Starbucks daily, you can definitely afford your hormone replacement therapy.
Do you work with your customers at all? Let's say in any kind of a pain, if somebody's on a regular diabetic or they're on a regular medication, but they want to go through you because they know that you are the trusted pharmacist. Like somebody like me, I have a lot of allergies, and I know we talked about this. I'm allergic to a lot of medications. I have every side effect on the bottle. I'm that girl that gets that side effect. Dr. Snipes knows because he prescribed something for me as my doctor, and I had immediate reaction. He's like, people don't get that reaction. I'm like, I'm that people. So, if that ever happens, and I have, what I love about you, Stephen, is that I know you're going to know my history, and you're going to say to me, Liz, you had a reaction with this last time, whereas the big farm guy is not going to notice because I'm one of 4 billion in their computer. So I love that. But let's say I needed you to work with me for a little while. Do you do that when you get to know your customers? You really just can't afford that.
Absolutely. No, let's say you're a male and you're on testosterone replacement therapy. And let's say that if you go through Big Pharma, you know that the brand is going to be cottonseed oil that they're going to mix with. Let's say that you have a reaction to that, or you have a reaction to sesame oil. I can compound something with grapeseed oil that is going to be less reactive and might work better for you. So yeah, can we work with specific cases? That's exactly what we do.
So if you know that, let's say I'm sensitive to, whatever, peanut butter, whatever the ingredient is, and that's common in some sort of a medication, and you can actually tweak that medication and make the actual part of the medication that's working still in that medication, but take all the extra stuff out that was maybe, is that what you're talking about? Like the stuff that's not as important, or you can find, explain what you mean by that.
Okay, so let's say that, so if you have an injectable testosterone, or let's put it in female terms. So let's say that we're going to prescribe you estrogen, progesterone, and testosterone.
Okay.
Probably what I'll do is I will compound the creams separately to begin with, to make sure that there's no adverse effect as far as what you're having. And then once we've figured out what the dosage is and that there's no issues, then what we'll do is we'll put all those together in one specific cream so that you'll have just one application as opposed to
Now,
three.
you mentioned a cream, so I can get it in a cream, and there's other ways. What if I don't want a cream? What if I want
We
to...
have creams, we have gels, we have troches, we have capsules.
Troche, what's a
So-
troche?
A troche is basically it's going to be dissolved in the cheek. Phenomenal. It's just yeah.
We have another call. Guys,
okay.
this is our winning
good,
show.
good,
Ding, 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 ding.
good.
3 calls in one show. You guys are popular. Who's on the line? Caller, hello, and welcome to Stay Alive and Fit.
Yeah, hi. My name is Rich, and I had a quick question relative to hormone replacement therapy. And you mentioned testosterone. I believe testosterone was mentioned. And my concern to be this: does hormone replacement therapy pose risks for cardiovascular damage?
It can, and that's one of the reasons why we do the blood test to make sure and you're monitored by an MD.
At the same time, also, the studies showed that it was with usually older men, say greater than 60, 65, and particularly if they had had a recent heart attack or some sort of cardiovascular event.
Yeah, I happen to have atrial fibrillation, so that I'm kind of mindful of potential problems.
How old are you?
I was born in 1942.
Okay.
74.
Okay. So you're just a real young guy. Okay, good.
Oh, yeah. But beyond that 65 number.
But it's like everything else. You have to take all comers and individualize. It's like what Stephen, the pharmacist here, was saying. And that's another reason why if the physician can slow down and just individualize things, because if you do feel better on testosterone, and maybe you just have atrial fibrillation, I'm not minimizing that, but I'm saying if you have that and you do okay, great.
Underneath the watchful eye of a physician, it might increase quality of life where you would justify.
Absolutely. So it's not a cookie cutter situation, but if a person felt better, then being careful.
What are the ramifications of taking hormone therapy with somebody with AFib or something like that? I mean, are they basically saying I have to give up my treatment for AFib to get hormone therapy, or is there a way to? I'm
Not at all.
confused by that.
Well, not long ago, a couple years ago, they were talking about men having problems with testosterone as far as early heart attacks and so on and so forth, and strokes and whatnot. The bottom line is, once that's been more refined and drilled down, it's primarily in people who are older gentlemen, but at the same time, the more acute setting. So, for example, if somebody had an event within a month or 2 or 3, and I mean in a more acute fashion, as opposed to maybe he had an event several years ago. So,
Richard, your AFib, is that under control now?
Yes. It's non-symptomatic, but it's a constant. It's there.
Would he be a candidate of something like this, or likely not?
no, I think you would be. I mean, you're on it right now, and you're being monitored by a physician.
Yes, that's right.
Yeah, I think that's totally appropriate. Again, you have to individualize every case. And like Dr. McCord was saying, if you felt better on that and he's keeping an eye on things and it sounds like he's doing all the right things, great.
And what is the difference between the bioidentical hormone forms and the HRTs?
That's going to be the difference between the synthetic and the bioidentical. So it's going to be what mimics most that's made in the human body.
So do
it's gonna be the
sometimes
closest.
you use one and sometimes the other, or you should really always not use the HRT?
No, not necessarily. It really depends. The majority of your injectables are going to be synthetics, whereas the creams are going to be your bioidenticals. So let's say that we want to move towards something more bioidentical for the gentleman that we're speaking with, Rich. Then we would look at a cream or a gel to suit that need.
Richard, do you have
gentlemen seem very cautious in your approach, and I really do appreciate that, and certainly appreciate the program as well and the opportunity to raise a question like this.
Well, thank you.
Thank you.
Do you have any follow-up questions, Richard, that you'd like to ask them? You're welcome to.
No, not at this point, Liz, but thank you.
Thank you so much for the call. We appreciate it. And if you'd like... You still there, Richard?
Yes, I am.
I apologize. It's hard for us to hear you in here. It's
Yep.
a bit of an echo. So thank you so much for the call. If you'd like to get in touch with either or any of the three gentlemen in the room here, I'm going to let you give their numbers out. We really appreciate all the callers that have come this evening, Joanne and Lauren and Richard. And if you want to call us, it's 888-565-1470. If you'd like to email your questions, it's liz@stayaliveandfit.com. And if you'd like to like us on Facebook, we'd appreciate it. So I'm going to let Stephen give out his telephone number quickly, and then we'll let the doctors across the seats give us theirs as well.
My number is going to be 561-252-2592.
I also want to quickly touch on the fact that we have a wellness center also with our practice, where where you can look at more Eastern style medicine, look also nutrition and whitening as well, and
Whitening of the teeth, that sort of thing. And like I say, wellness.
So you
And
have
that's,
dental services.
well, not really specific. It's mainly just whitening of the teeth and such. Yeah, and it's a wellness focus on the second floor.
Very
of the
nice.
office.
right, more of an Eastern approach to it. And I'm sure they can give you more details if you look into that. You want to go ahead and give our telephone number?
Yeah, 954-491-6200. Can I bring up one thing about this?
Absolutely.
One thing that's important to note is that there's estrogen levels in men as well.
Yes.
So when you're on testosterone, you're going to need to keep an eye on the estrogen levels as well. And
Right. Because the testosterone is going to aromatize into estrogen, and you're going to want to block that. And so with an Atrial, something along those lines, really
That might
works
not
well.
turn out the way you want
Right.
it.
Well, some people
Yeah.
might want it that
Yeah,
way.
Victor Victoria.
Yeah. You want to make sure we have that in hand, or you'll find yourself with a
Right.
pint of Haagen-Dazs sitting on the couch watching Beaches.
Yeah, that's right. Or the notebook.
Again, some
Yes,
people might want
exactly.
it that way. You never know these days.
Yes,
you know,
right.
we have listeners from all walks of life, and like I said, I think a lot of people just aren't aware that women have testosterone and men have. Estrogen. And, I guess there is an awareness because if you're bisexual or gay, then, you're trying to enhance the female hormone or the male hormone to change, so that you can be more one way or the other.
Right.
But when you're just, a person who is not bisexual or not gay and you're over a certain age or you're in menopause or what do you call it for men? If it's penopause?
Andropause.
We need to get a term.
Pantypause?
Yeah, we got to get a good term.
Andropause.
Huh?
Andropause.
Or menopause?
Andropause.
Andropause? I like
Yes.
menopause.
Yeah,
I
I like
mean,
that. Or just crabby man. How about that?
or crabapause.
Yeah, crabapause.
But you're
yeah.
crabapause even when you're not menopause.
Well, that's
Come on.
true. That's true. Especially when we don't eat McQuarters.
So this has been a fun show.
Yes.
We have about 8 more minutes left in the program, and I wanted to talk very quickly because I know the caller called in about animals and canine, and I know that's not necessarily your topic, docs, over there, but I do think it's an important thing to touch upon because I know Stephen's Pharmacy does more than just humans. It does work with animals and mixing animals, and that's a very big market these days, isn't it?
Yes, it is. Now, that's not something that we, do that I would say is a huge percentage of our business, but at the same time, it is something that we can do. It's just something that we haven't really gone out to
Market.
Exactly. So,
But I only wanted to bring it up because we have a caller who called in that hopefully will be a new customer of yours, Stephen. And not only would you
Absolutely.
hook her with her pet, but you'll hook her with your, with taking care of her hormones and all those other things. But the point of it is that it is a good possibility that, just people listening to the show, the fact that you do that, and you're working with people with their hormone therapy and all their other pharmaceuticals, that a lot of them are pet owners, and you might find that you'll get a lot of, you might start getting some more business just by simply, them being aware that you do mix for their pets now, which is something that I know you're not pushing or promoting, but it's a great asset. I mean, I love the fact that you do that.
absolutely. Kind of broadens the net a little bit.
Absolutely. And now I'd like to touch a little bit on the fact that you guys are affiliated with an endocrinologist, right? And
Dr.
so
Smolder.
can you tell us a little bit about her and what patients should think about or before they walk in and meet with her?
Well, Dr. Smolder has been in the Presty Medical Clinic for many years. Yeah, as long as I've been there, and certainly many years before. He's an endocrinologist. I think he did some teaching.
Oh, it's a
before.
male. I'm
It's a
so
male.
sorry.
Smolder's an endocrinologist, and basically he does really anything with the endocrine system. Pituitary disorders, diabetes for sure, as that's part of the endocrine system and a derangement of that.
Right. And what he used to do, he used to travel around to the different hospitals before, and then he slowed down, and now he's primarily, outpatient now. So you get the benefit of him being at all the different facilities as well.
Now, does he deal with children or just adults?
No, to be honest with you, I think the whole, for sure, our part of it is just adults, and I'm pretty sure he's just adults only as well.
It's an adult practice.
Yeah, he's an adult, endocrinologist. And then Beth.
And she's there, works side by side with him, hand in hand with him. And I figure, do you know their days?
I don't.
That's okay. If they want to find out more about how they can see the endocrinologist on staff or speak to either of you two, they can get in touch with Paul Presti, MD and Associates, located at 3075 East Commercial Boulevard. That's Fort Lauderdale, Florida. And the telephone number is 954-491-6200. They've been in business for 30 years. That's a long time, folks. They're not going anywhere. They're bringing in fresh blood. We got quarter pounders. We've got Mac Daddies and all sorts of, great information. But, seriously, the doctors that are sitting next to me, Dr. McWhirter and Dr. Snipes, they're very talented physicians. They work together as a team. They're internal medicine specialists. Dr. McWhirter has the wonderful ability, because he's a hospitalist, to be able to admit you by a phone call with the privileges at a 5-star hospital, which is Holy Cross, located in Fort Lauderdale. And that's really a wonderful thing, because I know when you call the ER, you have an emergency and you've got to wait and you get in there, but you can have a doctor make a phone call, let people know that you're coming. That's tremendous. So just by having these doctors, even though they take HMOs and all sorts of insurance, they give you that VIP experience every step of the way. And that's really what we need these days. Everybody should have the right to have a VIP experience. It doesn't matter what their pocketbook is like. They should have that right. And that's one of the reasons we do this show. And then with me to my right here is Stephen Schmidt of Tri-Coast RX. He's not the big pharma guy. He's the big guy sitting next to me. And he's a wonderful pharmacist. I've had quite a few conversations with him in the last week or so. He's extremely smart, extremely knowledgeable. I mean, a lot of pharmacists are very close to being doctors. I mean, I know that in some ways I trust my pharmacist more than my doctor when it comes to medication. When I'm taking a specific medication, I don't call my doctor to ask him if I could take it with Benadryl or aspirin or anything else. I call my pharmacist and they know the answer. And, when I speak to the big pharmacists, they don't know me. They just have to go, what's your phone number again? Let me look you up. But when you speak to Stephen, he knows you by name. He knows who you are. He's got that one-on-one VIP feeling, and he only costs you about a cup of coffee a day, folks. So, I mean, you can certainly afford that. So you should definitely get in touch with Stephen Schmidt, the name you can't forget. TriCoastRx.com is the website. I'm sure they have a Facebook page that you can like them on.
Yes, we do.
And you can like us on our Facebook page, and you can find them at 561-252-2592. We're saying thank you very much for everybody who called. I want to give Stephen one last chance. We have about 3 minutes left. I want to give Stephen one last chance to tell us all the specialties that they have at their pharmacy so that they can let listeners know what they need to do to speak to their doctors to send prescriptions over to him, and what specifically is his specialty. And then we'll have the doctors quickly say very quickly who the patient is they're looking for, and then wrap it up till next week, folks.
Anything from hormone replacement therapy to erectile dysfunction to thyroid medication, bias creams. I mean, the list is incredibly lengthy, but anything that has a specific need to be compounded, we're there for them.
You do IV antibiotics too?
Yes, we do.
Okay.
Injectable vitamins, a lot of different, yes.
And what's really, really cool from what I heard is that they can make it any way you want. So if you're somebody who can't swallow a pill, you can make it, you can compound it into a moisturizer or into a little thing that you put underneath your tongue, right, Stephen?
Troches, yes, absolutely.
What did you call it?
Troche.
Troche.
Troche, like a trophy for your mouth.
It sounds Star Wars, but that's what it is.
Yes, exactly.
Yeah.
What is that an acronym for?
I believe it's
got me on
European,
that one.
yeah. You've got me on it too. So I
Sorry.
apologize.
We're learning acronyms in the 5th grade and 4th grade now, and that's where my mind is sometimes. Okay, so thank you very much, Stephen. We've had such a pleasure with you on the show.
Yeah,
I hope
thank
you'll
you.
join us again. And I'm sure there's lots of things we can talk about when we focus the show on women's estrogen levels next
Yes.
time. And now to the doctors, just so they can say their final goodbye. What kind of a patient do you look for to come to your practice?
I'm just looking for a patient who's looking to get more out of life and how we can achieve that together.
And that they can grow old with you.
Exactly.
I agree. And men, come in. You're bad patients. You got to come in.
It's Men's Health Awareness Month, everybody. So please, this is the time. If you love your spouse, even if you hate your spouse, you need to get them to call their doctors and let them know that this is the month they need to be aware of their health. And call these wonderful doctors sitting next to us, call these pharmacists sitting next to me, and welcome to Stay Alive and Fit every week, 7 to 8 p.m., Monday nights. Thank you so much for listening. Good night, folks. See you next week.
You've been listening to Stay Alive and Fit with Liz Goodman, a new innovative radio show that taps into what's happening now in the medical industry, featuring fitness experts, foodies, and medical professionals from Tenet Health, with breaking medical news from David DePino. Get it right here and be an active participant in your health. Mixed messages about what is best for your health can make you feel like you're on a runaway train. Get ready to hop aboard again next time for Stay Alive and Fit with Liz Goodman. The opinions expressed on the preceding sponsored program were